Hi, I'm Dr. Hussein Musa at Kingdom Healing Institute in San Antonio. Now, if you're seeing this video, that means you probably have chronic pain. You're in the right place. I'm a triple board certified pain medicine physician, and I have over 15 years experience of treating chronic pain. But today, I want to focus on something that you haven't experienced. Now, have you been to the doctor and told them your story over and over again to receive the same injections, the same medications, the same treatment without any results? Well, today that's going to change. I want to talk to you about axon therapy. It is a new treatment and it's different from almost anything I've ever seen. And it's definitely different from anything that you've tried. Axon therapy is FDA cleared to relieve chronic nerve pain. It works completely from outside your body. There are no needles, no injections, no incisions, no medications. Instead, it uses focused magnetic pulses that gently pass through the skin to reach the nerves responsible for your pain. Each treatment only takes 13 minutes. It's painless. There's no downtime. You walk in, you receive your treatment, and you get better, and you go back to your regular day. I know that sounds a little too good to be true, but I want to tell you about one of my patients. This patient was injured in a car accident and unfortunately injured their back, their knee, and their hip. And they didn't have access to timely therapy. So a lot of this pain didn't get treated immediately. And now, years later, this is chronic pain. The pain is so severe, the patient lives with a 7 out of 10 pain. That's a terrible way to live. Any pain is a terrible way to live, but especially 7 out of 10, that means there's not a moment of your day without pain. Well, this patient came to me with a really tall request. They didn't want injections because they were concerned about the side effects. They didn't want steroids, they didn't want medications, and they wanted something that worked. And I was blessed to be able to offer them axon therapy. After 2 months of treatment, this patient's pain went from a 7 out of 10 to a 2 out of 10. And a lot of days there was no pain. You heard me right. There was no pain. Now, this patient is back to exercising. She is able to move around better. And now there is hope. Not only did we help with the pain, we restored hope. And that was with 2 months of treatment with no needles, no injections, no pain. Now, is this an isolated incident? No. I had another patient with bilateral knee pain. We started axon therapy, and after 2 weeks of treatment, there was no more pain. No medications, no injections, no side effects. This is revolutionary. And as a pain doctor, I'm trained to do all sorts of interventions. And you've likely endured those interventions. But what's the difference? Why should you come see me at Kingdom Healing Institute? I'm a concierge medicine physician, and that means that I have time to spend with you. You're not going to be rushed out of my office in 7 minutes. A matter of fact, we're going to spend up to an hour developing a treatment plan for you, and we can determine if axon therapy is right for you. And if it is, you're going to see tremendous results. Now, what's the catch? There's nothing that works this good without a catch. I can't promise that axon therapy is going to work for every single patient, but the good news is you get to spend time with an expert that will work with your specific problem and give you the best chance at pain relief. If you've been suffering with pain for all this time, it's time to do something different. You need more than 7 minutes. You need more than just an injection. You need axon therapy. This can help with a lot of your pain symptoms, and you aren't going to suffer side effects. So, what's next? If this sounds like something you're interested in, if you're tired of having pain, if you want your life back, please sign up below. Send your information and schedule an appointment to see me, Dr. Musa, at Kingdom Healing Institute. God bless.